Welcome, everyone, to the Community Pharmacy New Revenue Roundtable. My name is Breck Rice, and I hopefully have some amazing information that you can take away from today and implement immediately and start earning additional revenue. We host these occasionally, and so if this is your first time, great. If you've been here before, welcome back. There's always new information. We're always making new partnerships and relationships. And the reason why we do this is I've been helping community pharmacies now for over 20 years. And you can see by this post, me posting on LinkedIn information from Fortune, that for the first time in our history, our independent pharmacies have started to close their doors, and we've dropped below the 20,000 independent pharmacy mark. And big portion of that is because of lower reimbursements and, of course, the DIR fees. Back when I started 20 years ago, profit margins right here were 36%. Today, they're only 3 to 5%. So it's pretty hard to stay in business if that's what your focus is. And so one of my favorite quotes from Wayne Gretzky, when asked what made him so much better than the other players of his time, and this is his response. He skated to where the puck was going to be, not where it had already been. And so that's what we need to do as community pharmacy and business, small business experts, is we need to start to skate to where the puck is going to be. One of the programs we hope that all of you are aware of and are utilizing, if you are in a state that you can utilize this program, because some states just don't allow a out of network. You have to their monopolies, and you have to run it through their state program. But for the majority of the states, the ServeRx program is an amazing one. And I'd love for Will to take a minute and tell us more about the program.
This is an amazing program.
Will, are you available?
Hello. Yes. Can you hear me? Hello?
Yeah. Hear you now.
All right, perfect. Like Greg said, ServeRx is an amazing program, especially for community pharmacies. We're just here to help keep those fair reimbursements that the pharmacy legally deserve. As you can see right here, for example, Meloxicam. If you was to process that Meloxicam through a PBM, patient comes into your pharmacy, they need a Meloxicam. You go through a PBM, your pharmacy may receive $4 to $5, and with some pharmacies say that's generous, right, from them. But if you was to process that Meloxicam through ServeRx's PCN, your pharmacy can be reimbursed anywhere from $91 to $101. And how ServeRx is able to give you that fair reimbursement that the pharmacy legally deserves is we reimburse the pharmacy of AWP. So each state has a state scheduled fee, and majority of the reimbursements for AWP will be for brand medications, 85% plus a $2 dispense fee of AWP. Then for generic medication, 70% plus a $2 dispense fee of AWP. And that will be reimbursed to your pharmacy in 30 days, your central pay, or if you are an independent pharmacy, it'll be reimbursed 45 days directly from ServeRx. Also, when you're adjudicating through ServeRx, we do have a help desk that's available 7 days a week. So if the pharmacy was to receive a rejection for a claim, we give our help desk a call. Sometimes it's missing data may be missing, and our help desk can help the pharmacy, complete that paid label. Yes, we're just here to help.
Will, excuse me, Will, let me interrupt. People are having a really hard time hearing you. You're kind of cutting in and out. Let me, I don't know if you try to adjust your microphone or something there, but let me just jump in real quick and just let you know, if you're with a PSAO, you're already contracted. We are the preferred provider for all of the pharmacy management, the wholesalers and their PSAOs, the buying groups. We are the preferred processor because our reimbursements are so much more fair. The reason being is that we pass on the majority of what is, the state fee schedule, whatever is stated as the state of jurisdiction. That's fee schedule we pass on to our pharmacies. As Will mentioned, those rates are 70% of AWP on the generic and 85% on brand, plus a $2 dispensing fee. So it's an amazing program. Those pharmacies that have actually gone out and acquired workers' comp, going to the doctors, the pain practices, the orthopedic groups, surgeons, anyone that may see a high volume of workers' comp, have done very well. We have a pharmacy partner who was actually able to open a second location just off of the new revenue that they had earned from workers' compensation. So thanks, Will. Sorry we couldn't hear you very well, but you always know your stuff and appreciate everything that you do. We firmly believe that if our independent pharmacies don't try to bring in at least 1/3 of their revenue through non-dispensing means, that it's going to be really hard to stay in business. And so that's why we have partnered with the programs that we're talking about today, is to help you bring in additional revenue. And as you can see, our independents are not at that 1/3 part yet. Supermarkets, obviously, because of their grocery sales and the big box mass merchant pharmacies, they sell more front-end items than they do dispensing medication. But you can see we need to make a shift and start bringing in more non-dispensing revenue. So we have partnered with some amazing programs to do that. One of those is point of care testing institute with site labs. This is a fantastic program. Do we have anyone from Site Labs here? I'm sorry, I don't have my other screen that shows me everybody that's participating, but I certainly would rather have someone from Site Labs or POC-T cover this, because they know their stuff a lot better than me. Some fun facts though here about DIR fees. Does anyone realize that those have increased by 91,500%? I mean, this is just crazy. So put that in perspective, $4 gallon of milk would cost over $3,600. So, this is just proving that, hey, you're getting beat up, not only in your reimbursement, now also in the clawbacks with DIR fees. So, when something isn't working, you need to break out of the status quo and do something different. And so POC-T is one of those programs for home testing that's available to you. One of the other things we're going to talk about is the whole wellness center concept. If you have an MTM room or a private consult room, you can actually turn that into a wellness clinic. We'll talk more about that. Once we have enough of these set up, we'll actually be marketing this to the payers and the employers so that they'll be directing patients into you, because as you can see, it's a significant cost savings to the healthcare system, but also brings additional revenue into our community pharmacies. Other opportunities right now that you should be looking at is, things where you're doing the same amount of work, but you're able to get better reimbursements for that, and that's in your vaccines. Anytime you're giving flu shots, you can see that one client of ours here did almost 10,000 flu shots last year, and their approximate reimbursement was only like $17 a shot. So that equates to $167. After credentialed to be able to bill this on the medical side and provide the same amount of work for the pharmacy staff, but actually billing it like a clinic, they're predicted to be well over $1 million for the same amount of work. So certainly something to take a look at. Other things that you should be looking at doing here as well is doing other testing programs as well. and one that we really like right now that I think is going to be mailbox money for our community pharmacies. It starts here in about 4 or 5 weeks, so you have plenty of time to get enrolled and set up and ready for this program to launch. It is a public health service for a situation that I didn't realize was as big of an issue as it is, but it's for the STD, STI testing. But this is a at-home test that the pharmacy simply gets assigned a unique QR code to your pharmacy. And every time a patient, can discreetly scan that QR code, I would put it on your website. I would put it on any material that's public facing, that this public service, health service is available. The patient can just discreetly scan that QR code and get all the information that's needed. If they order a test, the pharmacy is paid a referral fee of in between $10 and $15 for every test. The difference is what panels that they're getting. So there's like a 2-panel, a 6-panel, and a 9-panel. So depending on what test the patient orders, that depends on what that referral fee is back to the pharmacy. Then you're also the pharmacy of record. So if the test comes back positive and they need an antibiotic, it's then sent to your pharmacy for pickup. So an amazing program. Like I said, I think it's mailbox money for our pharmacies to get enrolled with that. I'm putting together an enrollment sheet for them so that they can see the number of people that want to participate in that program. According to the CDC, 1 in 5 Americans. So that's about 66 million people. And it's like 33,000 new cases per day, I believe, is how the math works out on that. So it's a huge opportunity for us to capture. This is the sample test here. We were showing it at the NACDS conference a couple of weeks ago. It's really well put together. It's almost like a really fancy Apple phone case, with the magnetic lip on it and stuff. So it's really classy program. And again, totally discreet. So not only can the patient order the test discreetly, they can also, if they do test positive, they can also have a confidential telehealth visit, so they don't even have to go into their PCP or their primary care provider. Right. The Wellness Center obviously starts with a collaborative practice agreement with a physician, and so bring in telehealth into the clinical setting. The physician only needs to do the intake, right? And then using technology right through your camera, right there, through your camera, you can actually get the vitals for the patient. Patients love this because it's really cool technology. And it's fun using AI. So for personal medicine, I did a quick video that I posted. I'm just going to play that for you here and tell you what the next phase of that wellness center incorporates. So we have partnered with gene markers lab for this first phase of pharmacogenomics. They have a collection and patient consult reimbursement to the pharmacy that's $110. And some insurances are starting to cover this, and the pricing is starting to come down on those comprehensive tests as well. But today, Medicare will cover it with some stipulations. So they, oh, sorry, I guess you guys weren't able to hear the audio on that video. I'm sorry about that. I will post the replay of this, and you'll be able to hear the audio just fine on the replay. Apologize for that, but it's talking about pharmacogenomics and personalized medicine. So the criteria for Medicare to cover this is multiple medications, or 3 or 4 medications. One needs to be either a heart med, or one could be a psych med, and then they'll cover the pharmacogenomics or PGX. The lab that we're working with to do the STI testing program, if we do a really good job of capturing a good market share of those 65 million patients, we believe they'll actually be able to get the comprehensive price down to under even $100 for a complete comprehensive. So today they're about 550 to 700 for them. So, but an amazing opportunity for our pharmacies to get involved and help patients actually identify the medications that do work for them and get rid of the ones that are doing more harm than good. Didn't see Kent here today, but we've invited Kent and the Functional Wellness Network to be a part of this program, because this is just really good technology that was actually invented by the NIH to identify someone's health level or nutrition level. So simple bioscan, this S3 bioscanner can identify what the antioxidant levels are of a patient, and then you put them on a program to get a better score. So you get a baseline score with this, then you put them on a program so that you're selling more of your nutritionals, and then you bring them back in. So it's test, therapy, test. So then they come back in 6 to 8 weeks to rescan to show their improvement. So an amazing way to help you increase your your profitability and your revenue on your front end products for your nutrition and supplement program. I did a workup here, and I talked about what would it cost to, or what you could earn as a pharmacy by just doing 5 patients a day. And this is, I think, only on a 6-day a week. I can't remember. It wasn't all 7 days, but basically 20 patients a week, 20 to 25 patients a week. And it still generates, in the first year, about 72,000 in revenue. They also have a program where they provide nutrients that are guaranteed to help the patient's score go up as well. But if you have your own nutritional program or diet programs already in place, this complements that and goes hand in hand with it. The bioscanner doesn't care where the nutrition comes from. It's just giving them a baseline score and then showing if they're improving or not. Blood analytics. Is Brandon here today? So Brandon works with Marianne Marks at Lab Smarts. This is incredibly cool technology to look at blood markers, to identify also deficiencies and catch diseases before they actually turn into a full-blown disease state. This is all part of that Health Hub solution to be able to really focus on helping patients not just feel better, but actually get better or prevent disease before it starts. This next technology, I have personal experience with it myself. About 6 years ago, I was introduced to PEMF, pulsating electromagnetic energy field, to help with patients, but no devices had ever gone through the FDA approval. But my experience with it was my niece had gone through chemo and radiation. She had taken the maximum dose of radiation that her body could handle in her lifetime. They cured her of the cancer, so thank God for that. However, all of that radiation created all kinds of scar tissue and problems where she couldn't even breathe without the aid of oxygen. We found this doctor up in Scottsdale that had invented his own PEMF device, and he had a therapist that could do some work on my niece, and it opened up her lungs, allowed her to breathe. She called it her magic box. So that was my first introduction to the technology, and a personal witness that it works. Well, fast forward now, about 6 years, find a device that has actually gone through the FDA process to get approved. It's an NGX class 2 medical device, which means we can bill insurance for the sessions. And what this device does is, unlike the PEMF and the muscle TINS units or muscle stimulation that are working, contracting the muscle, relaxing, or working from the outside in, this is at a frequency between 10 and 30 megahertz. So it's really low frequency. It can actually get to the interior and work from the inside out. It's improving vasomotion by 30%, so more oxygen and nutrients getting to the cells, and taking the metabolic waste out faster. In fact, we have a doctor that runs a recovery clinic that is using this medical device to help flush out the toxins in patients when he has them in recovery. So what I want to show you here is a really extremely blown up view of a arterial bringing blood to one individual little capillary, and then you're going to see the venule taking the blood back to the heart and lungs. So here's the little capillary, barely getting anything happening there. Only 3 minutes of treatment, and it's just flowing naturally. After 6 minutes of treatment, it's flooding in there like the Autobahn, and you actually even see more activity on the venule side. Let me back up a little bit here. The returning blood, there's more white blood cell activity. It doesn't produce more white blood cells, it just makes it more active. It does, however, produce more ATP, or cell energy. That increases by about 22%. So amazing technology to not only increase circulation, but to reduce inflammation. Out of the 45,000 disease states, I mean, I'm preaching to the choir here, you guys know this stuff, but out of those 45,000 disease states, over 90, about 93% of them originate from inflammation. So if we can reduce inflammation, if we can reduce free radicals, if we can reduce the oxygen, blood from not being able to take out the waste so much faster, we're going to be able to do a lot of preventative maintenance and care with patients. And it lasts. This is still after 30 minutes of treatment. It's still, so it lasts up to about 18 hours in the patient before the next treatment. This is us just showing off the device. So doing a treatment on Slick Willie there. So Mr. Shaw, that just wanting to show what the device looks like. So that's the actual medical device. There's 2 ports on it. One port is going to this med bed. So imagine like a high-end yoga mat, if you will, that has the coils through it. Most people's heads would be about where Will's shoulders are. He just happens to be really tall. So, but most people's heads would be about where his shoulders are. Let me go forward here, and you can see that we're also treating with the other port his ankle. When he was playing basketball over in France a few years back, he broke that ankle and has a plate in there and some screws and stuff, and just never had full range of motion. The scar tissue just really has built up there. And so we're breaking down that scar tissue and helping him with, get more motion in that. So just wanted to show what the actual device looks like, and also show off some of Will's tricks as well too. So yeah, that's what he's famous for, is the double ball spin. All right, so here's an independent study that was done on a bunch of different devices that fall into that PEMF category. They put all these patients on the different devices. The device that has the first one to have that FDA Class 2 approval is called a bioelectromagnetic energy regulator. That is way too much to state all the time, so they just use the acronym BEAMER. So this BEAMER device, first day you can see that the oxygen utilization and vasomotion is well above the competitors. Second day, clear up to 25%. Third day, it's clear up to 30% more vasomotion, more oxygen utilization. Then they took all the patients off, and you can see that all the other devices dropped basically down to zero. But the BEAMER device, it still was showing improvement over even what the next best competitor's level was. So this is amazing technology, pretty excited about it. It's going to be big business. Big tech and big pharma are partnering up to create more of these bioelectronics. I personally met with the owner and founder of the company. They're developed and manufactured out of Germany. But I didn't go to Germany. Luckily, he was here in the States. He was over in California. I went over and sat down and met with them, learned as much as I could about the technology, and negotiated a master distributorship for our community pharmacy. So this is something that is being made available for our community pharmacies to put in these health hubs. The total program is called the Fountain of Youth. You can't trademark the Fountain of Youth, and so the acronym FOI, F-O-Y, is used. So FOI therapy, and it includes everything: your credentialing, licensing of software, the full medical device equipment, everything that's needed, and even the billing and collections is available for you in a nice little package program. So if you do have room, if you do have a consult room, or if you're planning to expand and add more clinical services, this is something you really ought to look into, because the ROI is like, so far there's about 10 or 12 locations that have set up, and we're seeing a return on investment in about 2 or 3 months is all for what you're earning in additional revenue coming. Also, to make it that much easier, we partnered with Walter Grain and Grain Funding. They have an amazing business line of credit with zero interest. So most people qualify for 15 to 18 months, zero interest on this. So not only can you, borrow or have the credit line to borrow the money to implement any of these solutions, you can then also, pay that off before any interest has even occurred. So amazing program. Love to get you in contact with him if you're ready for expansion. So next product I'm pretty excited about too. I found this and been working with Scott Lamphere here for a couple of years now. So this has been around right. We learned about this right in the middle of COVID, and wish we would have had it before COVID. But I can tell you personally, took a family trip to the only country that would allow travelers during the pandemic, Mexico. Okay, so we went down. Yeah, they'll take your money no matter what's going on in the world, right? So we took the entire family. There was 10 of us. I've got 2 little grandkids. I used this product. There's some really nice handy wipes. And they're huge too. It's like a small towel when you pull it out of the package. One of those handy wipes, I could wipe down both of my grandkids from head to toe, because I knew they were going to touch everything on the plane. They were going to play with the tray table and the seat belts. They were going to touch everything. They were going to be crawling around on the floor, whatever. So I wiped them down. And what's so cool about this product is it creates a covalent bond that lasts up to 4 hours. So I had full protection for the entire flight. It was amazing. But anyway, that's my personal experience. I will tell you one other thing. We, along with this and some air purification purification. We made it back to, through the testing and everything to be able to come back on our appointed time. One of my good friends and one of our business partners at ServeRx ended up getting an extra 2 weeks of vacation that they hadn't planned on because someone in their party got COVID. So why don't you tell us more about this? You're the expert,
So practical experience along with academic experience.
Yeah.
Well, this is pretty straightforward. The people on the call here are very experienced and smart people, but we are changing how we're killing germs. We're going to do it chemically, without chemicals now, and we're going to do it physically. And the nanotechnology that we use creates a flexible barrier, doesn't sink into the skin. If you're talking about, excuse me, the hand sanitizer or the body spray or the wipes, the barrier does not sink in like an alcohol products that you use now sink into the skin. This is a surface products. They're all water-based. They're all FDA approved. And we also have a couple disinfecting products which are under the EPA that's registered and approved. But these are very, very durable products, because if you can do the hand sanitizer or the wipes like Breck was talking about, you get 4+ hours. So if the FDA allows us to say 4 hours, what do you think's really going on? It's going to be getting you much longer protection. I have studies that show that. But officially on the labeling, we can say that it'll get you up to 4 hours, and it gives you a peace of mind. My gosh, because the misinformation about just hand sanitizers, because we all hate them now. We didn't know what one was 3 years ago, but now our hands are chafed and horrible because the protocols we're having to use it all the time. So now with a water-based product, it's 4 hours. You can't tell it's on. You really can't smell it or taste it, or as they say, you just don't have any understanding of something. Would you agree with that, Breck?
Yeah, no, it's a pleasure to put it on because it goes on silky smooth, and like you said, doesn't dry out your hands, and then it doesn't smell like really bad tequila
and our sticky residue. So
Yeah.
on the slide there, Breck is showing you that we're actually attracting the pathogen cells to the barrier, which is because our world that we touch basically is a negatively charged world. So part of our program is that when the cell comes and gets lands on the barrier, it gets pierced by a carbon spike, and then it gets destroyed by a nitrogen molecule. So and it just does it over and over and over. And then one of the huge pluses of this is that it stops cell mutation. It doesn't allow its brother to send signals back to the colony and say, hey, this is what's killing us, like bleach. Back in the day, bleach killed everything. Now there's several strains of bacteria that are resistant to bleach, and say, hey, talk to the hand, or you're going to have to use a whole lot more because we're very resistant, and that's a scary thing if you understand what plastic bleach is. So I just let everybody know just to email me. I put my information in the chat if you want more information or how to get these products. And as far as the community pharmacies go, it's important that you can stand behind products that are not going to be harmful to your patient's health by using them. And you've got a decent profit margin there, so you can certainly put these on the shelf and not just have it at your counter. You should be able to promote this and use this in the health hub type of thing too that Breck is creating. So you just create a whole environment that we take the heat down as far as non-chemical based.
Awesome. Yeah, amazing product. They also, for you that are doing compounding, they have EPA surface products as well. And those last longer because they're not flaking skin cells off, right? How long do the surface products have that protection?
The EPA says 28 days, but I have study results and field results that are more like 90 to 120 days. But on the labeling, I'm able to say 28 days of continuous antimicrobial efficacy.
Okay, perfect. Yeah, amazing product. You should surely get a hold of Scott or just reach out to me and I can get you connected with him. Chris usually covers BioLite. He's not able to make it today because of another meeting. So let me cover this really quickly for you. This doctor here, Dr. Rollins, his wife was going through cancer treatment, and the only thing that helped her even get out of bed or even feel better was to get an intravenous IV. Well, that wasn't very practical for them to do that every day, and so it made it his mission to go create something that was absolutely everything you would get in a intravenous IV, but in a drinkable. So this is 550% more electrolytes than the leading sports drink, but without all the added sugar. You get this now through your wholesaler. So if you haven't brought this into your pharmacies yet, do. It's a great product. The only difference between this and actually doing an intravenous IV is because you're drinking it, you have to wait 15 or 20 minutes to get the results because it has to go through your kidneys first. But it's also doing your kidneys some good too, and it does that. But they use monk fruit instead of the artificial sugar. They need a little bit of sugar in there because that's also a carrier in order for it to take all the electrolytes and benefits to your cells. It has a little something in there that also helps with pain management and also for upset stomach, which also a lot of cancer people are suffering from upset stomach, so it helps with that as well. Anytime I feel a headache coming on, usually it's because of dehydration here in Arizona. Man, just drink one of these and just absolutely knocks it out really quickly. It's an amazing product. Again, you get that right directly through your wholesalers now. I don't know if I saw Tom or anyone from his team here today, but a secondary wholesaler that we really love is Real Value. We have pharmacies that are almost using them as their primary because the pricing is just so much better. We're looking at anytime that somebody has done an analysis on one of the or many of the 5,000 different SKUs that they have, they've always been able to come down by 10% at least, if not more. So if you want more information, or if you haven't or aren't using Real Value yet, just reach out to me. I'll certainly get you in contact with them. A great partner of ours. Well, Jonathan is someone I just met only maybe a week or so ago. He is involved in a project, but this has got me very interested on two fronts. Not only from the retail aspect of bringing this new product into your pharmacies to also increase more non-dispensing revenue, but there's a cool investment opportunity here as well. Jonathan, can you tell us more about it?
Yeah, thank you, Breck. Folks, good to meet with you over Zoom here. So I am the co-founder and CEO of Breath Rocks. And what Breath Rocks is they're basically sugar-free pop rocks with zinc. So it's a really fantastic product that is actually, it's been on the market for several years, but it was sold through QVC, through HSN, through Facebook campaigns. But the downside is they were selling it in a big $30 multi-pack. And so that was a big ask for people to say, well, I want to try out this Breath product. I'm used to buying a Tic Tacs for a couple dollars. And, the Pop Rocks, it sounds fun and the concept makes sense. But basically, a couple people came to me last Thanksgiving. They had acquired the brand. And I said, look, as I told Breck, you have to do three things. You got to completely revamp the branding. You need to go through independent pharmacies, and you need to do a crowdfunding campaign. And my rationale for that is that the packaging that they previously had, you can't really see too much, but these little vials, little tubes, they were focused on the flavor, the watermelon, the orange, the mint. They were calling these things popping fresh breath crystals. And I said, look, you got to call it what this is. This is a popping breath mint. You got to make this, really, bold and sexy. You got to, remind people of what Pop Rocks are like with the black packaging, things like that. And secondly, I said, you got to go through independence, because if you're going to try to go through Walgreens or Walmart, it's going to take you a long time. They're not going to be passionate about the product. Just get the product out there. Or if you walk into a pharmacy you can ask pharmacists, you can have them sample of this. They can say, wow, this is fantastic. They can put this right next to the Tic Tacs. And then when people are coming in, they can say, man, this is a fantastic product. Have you tried this? And so when I explain to them, rebrand it, go through independence, and then tap into the new crowdfunding regulations that allow the average consumer to say, I like that product. I'll put $500 in. That with me making that pitch, they said, well, why don't you become the guy to do it? So we've gone ahead and we spent money to rebrand the product, and we are going to be able to bring it to retail for $3.49. Pharmacists, it'll be a $1.74 to you folks. So you're going to have a 50% margin. And we've actually gone into production, and we're going to be launching at the NCPA show in Orlando in the middle of October. So we're going to have a booth right next to IPC's booth there. And so you'll be able to come in, try the samples, be able to order, and we'll be able to ship it probably through IPC or directly from our manufacturer in Wisconsin, or one of our medical supply companies that invested. So the other part that Breck mentioned is this idea of investment. I really believe that with pharmacists, as you know, one of the best things you can do, if it's possible, is to invest in your building. And so that after these many years of ownership, you've owned that real estate. I also believe that if companies are going to leverage your distribution to launch products through you, you should own a piece of that. And so what we've done is we're raising $300,000 for our seed loan, and we've already put together the first 100,000. That's what allowed us to put the money into production, allowed us to pay the legal and accounting fees to get the crowdfunding going. So we have, like, if you know Lisa Fast at Diversify RX with the Profit, Pharmacy Profit Summit, she's one of our investors. Cliff Holt, pharmacist down in Southern Utah, who used to be on the IPC board, he's involved. Peter Said, who's got 10 pharmacies in Louisiana, he's involved. Whatever. So like I said, we've got the money in so far to get the ball moving. We're raising another couple $100,000. And what we're doing with that is we're saying to the pharmacies, if you invest, let's say you invested, $10,000, I'll use easy math there. If you invest $10,000, when we launch our crowdfunding campaign, so in 3 or 4 months, we can pay you back in theory plus 25%. So you'll get 100, you'll get 14,000 back. Plus you'll actually have a $20,000 investment in our crowdfunding. So then that way you've got equity in the company as we go forth. And then as we do that crowdfunding campaign, the idea is to have tens of thousands of consumers who put in $100, $500, whatever, but also open it up to other pharmacies and C stores to put in a 500,000 and whatnot. And really, because the great thing about Breath Rocks is, just like with any other breath mint or gum or candy, it's something that you naturally are going to share just because you have it out. Now, if you've got a little skin in the game, it really gives you incentive to share it with folks. So would love to have, if any of you are interested in investing, on the next slide there, we've got my email to be able to reach out. But worst case scenario, we're going to have inventory here in about a little less than 2 months, ready to distribute. So would love to have you put this product right next to the Tic Tacs and Altoids that you're selling. But if you become an investor, you'll be able to make money not just in what you're selling at your pharmacy, but you'll get a little slice of what we believe, hopefully hundreds of thousands of pharmacies and C stores and retailers will eventually be carrying Breath Rocks, because it's not just a fun product. It's not just candy like other breath mints, but it really is functional with that zinc, because it goes in there and helps to neutralize the gases in your mouth that are causing bad breath. So it's just a fun, functional, flavorful product that we think is going to become ubiquitous, and would love to have you help us distribute it and help us become a shareholder if it's in the cards for you. So thanks.
Awesome. Thanks. Thanks, Jonathan. Appreciate that. It's Jonathan's information there up on the screen. Please feel free to reach out to me and I can connect you with him as well. Dry eye mask. This replaces a couple of medications and has about a 50% profit margin there for you. The manufacturer will actually give you a couple of these free. So he's basically giving you, a couple $100 worth of inventory just to get started with it. Incredible story. His wife suffered with this, and so he went out and figured out a solution for it. So if you're interested in starting the dry eye mask and having those available at your pharmacy, please reach out to me and I'll get you connected there as well. Let's see here. Cindy is here today. It's great to have you, Cindy. I'd love for you to talk to the group here about what you can do and help them save some costs on health insurance.
Absolutely. Thank you, Breck, for all you do for the community pharmacies. So hi, everybody. My company is Gordon Health Group. I'm an independent health insurance agent. It goes sort of this goes hand in hand in growing your revenues, but also keeping your costs down. Health insurance has become what we're familiar with, the golden handcuffs. We used to look at that as a 100,000 or more salary a year. Now the golden handcuffs are health insurance benefits. So people are looking to work at organizations that provide health benefits. And I know with small businesses, it's so challenging to afford health insurance coverage, especially with the margins that community pharmacies are showing, as Breck had mentioned at the beginning of the call. So what I do is I work with small businesses specifically to help them save around 25-35% on their health coverage premiums with really unique plans that are available in any state across the US. They work so well to help the people who are on the plan control their out-of-pocket costs. So it's, a win-win scenario. But it gives employers, pharmacists who own their own pharmacies, the ability to be a company of choice that people want to work with, that people want to be part of. And that is something that will help them grow as well. So, I would love just the opportunity to talk to pharmacists about health coverage, even if you don't offer it yet, because you might be surprised at how affordable it is and all the value that it would provide your organization. So thanks for having me as always, Breck.
Awesome. Thank you, Cindy. And several people are already reaching out to Cindy to see if we can't, help them save a little bit on their costs. I was just scrolling back through the chat to make sure I hadn't missed a direct question here. I noticed that Marie from mycity.com, who's our gracious host today, has put my information up in the chat. So please, before we end, make sure everyone saves the chat. It's really easy. Just while the chat is open, just go to the far right-hand side and you'll see those three little dots. Click on those little dots and hit save chat, and then you'll have my contact information. You can literally just click on that Calendly link and schedule a time with me. We have just a couple of minutes left here, so I do want to open it up to any questions that might be right on the top of your mind. Otherwise, we can certainly schedule a one-to-one. Let me tell you also too, I absolutely love community pharmacies. I usually start the meeting letting everyone know that. Been working with them for 20 years, absolutely love them. I think they're so essential to the entire system. I want the focus to be back on community pharmacy. I want them to serve that community as the health hub, be the place where patients can go and get some of these incredible services. And so I think we have some great partners here that can help you get that done so that you can become that vocal point again for your community. But love community pharmacies. We'll do everything in our power to make sure that you're successful. But any quick questions that we could answer for you at this time? And again, thank you so much for being here today. But yeah, if you've got a question, just simply come off mute real quick and we'll see if we can't get it answered for you. Okay, great. Again, and as you can see, everyone's contact information up in chat. Please save that chat. Simply, go to the three little dots and click on them and hit save the chat. It'll actually put it into your Zoom folder, which then will allow you to go. I like to copy it and just put it in a Word document, because then all the links are live in the Word document. So all the Calendly link and other email and all of that is usually easy to access that way. So I appreciate everyone being here today. Thank you so much to our presenters for sharing the information that you share with us. It's great to have you as a partner here. We look forward to seeing how we can, collectively help our community pharmacies and our small clinics become those health hubs. And so looking forward to working with you. Just reach out. Let's set up a time to get you, even if you just take one thing from today, if you want to just, you're already doing vaccinations and you want to get paid more fairly for those. Let's talk about that. Everyone should be involved in that at-home health test. That's a no-brainer for me, because that's one that absolutely I think is gonna just be mailbox money. Cindy, thank you for raising your hand, because I don't see everybody on the side. So thank you.
Absolutely. I just want to mention in the chat, Anthony had a question. When we become credentialized, we can then bill on the medical side.
Yes, thank you. I appreciate that. I'm just looking at the chat now myself. Yes, that's absolutely correct. Whether or not you've gone out and gotten a PTAN to bill on the medical for Medicare, it doesn't matter if you have that in place already or not. There's a way to help you get credentialed with all of the major payers to do all of these clinical services. And like the example I gave on flu shots, if you send you give a flu shot and send an invoice into Blue Cross Blue Shield, they may reimburse you about $17. If a clinic gives the exact same dose flu shot and sends it into to United or to Blue Cross Blue Shield, they're getting like $80 or $90 for that exact same shot. So you're doing the same work. They're just treating you like they always do, like a redheaded stepchild in the healthcare system. So we're going to change that and many pharmacies are already in that process of getting credentialed so that you can do this and get the fair reimbursement you deserve. Thanks, Cindy. Appreciate that. Where can we sign up for the at-home test? Just contact me. I'm putting the sign up sheet together. Just reach out to me. Let me know. The demographics that we need to know is just where your pharmacy name, where you're located. But yeah, I'm putting that sign up sheet together. Already have a list of people who are interested, want to be on that, and then we'll actually get you assigned a QR code. I also need to let you know too that even though you don't need to carry the tests in-house, you may want to have a few on hand, just because patients are going to come ask for them, I believe. So even though you're making it as discreet as possible, if your pharmacy is anywhere near a college campus, almost 50% of that 66 million falls into that college age range. So about 40% is of the 66 million people are between the age, basically college ages. So if you're near a college campus, absolutely, this would be a great program for you. And I'd reach out to the university and tell them that you have a public health solution, and you'd love to work with them on putting up signage or whatever to get your QR code published out there. Any other questions? Okay, well, I know we're at the top of the hour here. Thank you again so much for everyone being here today. And please save the chat and set up a one-to-one, and we can really dive into what you think is going to work for you and your pharmacy, and we can talk about some of the other options too that might help you be more profitable. Again, the pharmacies who have taken the jump and put in a full wellness center, they're generating anywhere between $20,000 and $35,000 per month in additional revenue. It's not easy, but it certainly could be done. We're here to help you any way we can. All right. Thank you very much, everyone. Have a great rest of your week. Take care now.